Good day, everyone! Today, we will discuss about the Bence Jones Protein, its principle and clinical significance of tests, and also what are the materials and procedure in performing these tests. So, let's start! So, what is Bence Jones Protein? Bence Jones Protein is a monoclonal globulin protein or immunoglobulin light chain found in the urine, with a molecular weight of 22 to 24 kilodalton. Detection of Bence Jones protein may be suggestive of multiple myeloma or Waldenström microglobulinemia. Bence Jones protein was first described in a patient admitted to St. George Hospital in London under the care of Dr. Watson and McIntyre for valve continuous pain to the chest, back, and pelvis in 1845.
The principles and clinical significance of Bence Jones protein tests.
The Bence Jones protein is a monoclonal globulin protein. Finding this protein in blood and urine is often suggestive of multiple myeloma or Waldenström's macroglobulinemia. The principle behind this test is the thermal method. Proteins has unusual property of precipitating at 40 degrees to 60 degrees Celsius, and then dissolving when the urine is brought to boiling 100 degrees Celsius, and reappears when the urine is cooled. The clinical significance of the Bence Jones protein urine test is used mainly to diagnose and monitor multiple myeloma, a blood cancer. Multiple myeloma happens when the plasma cells, which make the antibodies that fight infection, start to multiply uncontrollably and release Bence Jones protein. This protein does not serve any useful function in the body.
Here are the materials needed: 3% acetic acid, concentrated HCl, urine sample, and test tubes.
What's up mga chuy? So karon mag-istoryahan na kung paunsa nato matest ang Bence Jones protein.
Centrifuge about 25 ml of fresh urine. Test for protein with sulfosalicylic acid as in routine urinalysis. If the result is negative, Bence Jones protein is absent since SSA precipitated this protein. If positive, acidify 20 ml of urine with 33% acetic acid using the litmus paper. Place 5 ml of urine in each of the 3 test tubes. To the first tube, add 1 drop of 33% acetic acid, 2 drops to the second tube, and 3 drops to the third tube. Place all 3 test tubes in a beaker of cold distilled water on an electric hot plate. Mount a thermometer on the beaker. Switch on the hot plate. Secure that the test tubes are not moving to ensure even heating. And observe for turbidity. If Bence Jones protein is present, at least 1 tube will develop turbidity between 40 degrees Celsius to 60 degrees Celsius, but will disappear upon further heating. If albumin and other proteins are also present, these will not precipitate until the temperature rises above 65 degrees Celsius.
After the procedure, it is now time for the interpretation of results. To know that the Bence Jones proteins are present, it is important to note the following. Number 1, if precipitate is seen, further heat the urine to 100 degrees Celsius. Precipitate should dissolve in here. Number 2, cool the test tube to 60 degrees Celsius. In here, precipitate should appear. This confirms Bence Jones proteinuria. Take note that other proteins, once precipitated, they do not solubilize by heating. If Bence Jones protein is present, the patient has multiple myeloma. If absent, it does not rule out multiple myeloma. Multiple myeloma is a type of bone marrow cancer that is most common in people who are older than 60 years old. Take note, the amount of Bence Jones protein present in the urine indicates how much tumor is present. Thank you for listening. Don't forget to like and subscribe to our channel.
Ew.
Achoo!
Oy,
Pangti na?
Kachikon ka? Mag-atching jud ka sa